Chuck, you look already there.
Yeah, I'm just about ready here. We'll get going in just 1 minute. I'm
Great,
one last thing.
great.
Are you unmuting us as we speak, or are we doing that ourselves?
You can unmute yourself. I was just I hit mute all when I'm hearing extra noise.
I've got a mower on in the background, my neighbor.
I was talking and I wasn't unmuted myself. So we will go ahead and get going. It is now 1:15. Thanks everybody for joining us for our weekly call to answer media questions and discuss the collaboration for the county, the city, and IU regarding the spread of COVID-19. As usual, our media availability here includes Bloomington Mayor John Hamilton, Monroe County Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU Associate Vice President for Public Safety and Institutional Assurance Ben Hunter. I am Chuck Carney, Director of Media Relations for IU, and I will be directing the questions here. If you have a question, you can ask it live here, or you can put it also in the Zoom chat. I'll be watching those as they come in and directing questions as we begin. Let's start off though by going to Mayor Hamilton to give us a brief update.
Okay, can you hear me all right?
Yes.
Great. Thanks everybody. I just want to give an update. Again, thanks for hosting this. City of Bloomington, as many of you know, we've had 2 confirmed COVID cases among our employees. One announced last Saturday, fire department in our fire department, and one announced this morning in our Parks and Recreation department. We are publishing those to share with the public, to be aware of that. We are implementing all recommended CDC and state health and guidelines as we go forward with that. And we'll continue to do all we can to protect everybody. Also note that the Families First Coronavirus Relief Act, I think that's what it's called, FFCRA, is in effect now for many institutions, including governments, which is a new federal law that's allowing employees through a number of different categories, whether they themselves or a family member has been diagnosed or determined to be likely COVID-19 infection or some other approaches as well, can get 2 weeks full pay, as well as there's a new 12-week expansion of the Family Medical Leave Act, which is available for employees who have a dependent child that they need to care for due to school closings or childcare closings, just mentioning that. I did want people to know we've increased our monthly cabinet meetings in the city to weekly. We have weekly virtual cabinet meetings now to help coordinate all that's going on, as well as our continuity of city government team is meeting. I think they had their 9th meeting. We met today, 9th meeting in about 2.5 weeks to make sure we're reviewing all of the things we should be doing. I'll just briefly note too how much we appreciate the collaboration with Indiana University on the police. Our 2 police departments are really collaborating extremely well to try to monitor some episodes where we have non-physical distancing activities. We have a bunch of students back and others, and we're trying to make sure we share the review of those potential gatherings, and I really appreciate that from IU. I'll report as well the 2 work teams that we stood up 10 days ago or so at my request. They have been doing great work The social services team, which is led by 5 philanthropic leaders in the community, is digging into a whole range of challenges in the short and long term, including immediate shelter efforts. Just for the public, and very briefly, I'll just mention there are really 3 quite different sheltering needs that are being addressed. One is quarantine, people who are symptomatic or even diagnosed who need to be quarantined. That's one kind of housing need for people who don't have other options for that. A second is isolation, which is focused on at-risk individuals, not symptomatic, but at risk either due to age or conditions, who should be isolating, but for reasons they cannot do so at home. That's a second category of shelter. And a third category is really physical distancing for emergency shelter residents, residents who might be in an emergency shelter in much too tight an arrangement. And all 3 of those are being looked at very intensively with collaboration with our local partners. It looks like the isolation, I think it's, yes, the isolation center may be opening yet today. They have to pass a fire inspection today. And then I'll lastly mention, I think the second work team on economic and stabilization and recovery, a group of business and employment leaders who are working to stand up approaches that can address these urgent economic needs, including it looks like about $2.5 million up to that of local money that may be available to help support both hospitality industry, tourism related, as well as other small businesses and arts organizations. And so happy to talk about either of those, and just appreciate the collaboration of this team, and I'll hand it off to the next. Thank you, Chuck.
Thanks. So let's go to Julie Thomas for any comments that you have from Monroe County Commission.
Great, thank you so much. I appreciate everyone's time and everyone that's on this call for all their hard work for our community. We are always impressed with our Monroe County workforce, who continues to work from home and do amazing things. And we do continue to meet daily. We took last weekend off, and I think we're going to take this weekend off, which will be nice. But we've been meeting daily with all of the moving parts of county government to make sure that we're staying on top of everything, and couldn't do it without a fabulous staff. And just a reminder for folks who are, especially those who are in the gig economy or self-employed, that they are to go ahead and apply for unemployment. They could do so online, and even though the Work One offices are closed. And once they're denied that, they can then be covered through the CARES Act. So I want to encourage folks who are in those positions to go ahead and apply and make sure they take advantage of the benefits that are being offered. Also want to note that we do have our food and beverage support application available. It is on the county's website, co.monroe.in.us. And right from the homepage, you can find that link with some information and then the application itself. This is for tourist-related, locally owned small businesses in Monroe County, outside the city of Bloomington, that are suffering losses because of the pandemic. And this is a way for us to help provide some support, much needed support, to keep those businesses going so that they're there and they're strong when we're able to come back to full strength. So I also want to give a shout out to the great folks at United Way, Bloomington Economic Development Corporation, for their work on the coalition. We've had county commissioners on calls with the coalition, with the child care workforce team. So there's a lot of moving parts, and we're all involved, and we're doing everything we can. We're really impressed with the way that Monroe County residents are really, for the most part, doing what needs to happen. They're staying home, which is great, and this is an important thing to remember. Even if we feel we're fine, even though it's been a few weeks, we're in for the long haul. And so just a reminder that we are all in this together, 6 feet apart. And I appreciate the work of our health department, Penny Caudill, and emergency management, Allison Moore, and we're going to hear from them next. Thank you.
Okay. Why don't we go to Penny here next?
Great, thank you very much. So just kind of a general update. Hopefully people that want to look at the stats and statistics that are going on are staying tuned into the State Health Department's website and the dashboard. In Indiana, as of this morning, there were 3,437 positive cases confirmed. We unfortunately have had 101 deaths, and we have tested over just shy of 17,000 people now. So 16,900 that are reported by the State Health Department. In Monroe County, as of this morning, we had 40 confirmed positive cases. But we know that those are the people who have been tested, and that there are certainly other cases and additional people in the community who would have infection. And the other things about the dashboard, the state is adding some demographics and metrics. And so that will help us look at trends and things that are going on at a state level. And I believe that they're going to be adding some more county data. So that will be very helpful to us. It is clear, I don't think a surprise to anyone, that we are in an acceleration stage of this pandemic. No one really knows exactly when it will peak, but the state is estimating between mid-April and mid-May. And if we look at kind of our numbers locally compared to, say, Marion County, we're probably 1 or 2 weeks behind that. So we know that it's coming. We know the peak is coming, and we want everybody to do what the governor is asking us to do so that we can slow this spread down. Dr. Sharp, our county health officer, has asked me just to remind people that it is very important, as Commissioner Thomas was saying as well, to follow the governor's order. And that is a stay-at-home order, which is essentially a self-quarantine order with the ability to handle necessary and essential needs. So you can go to the grocery, you can do those kinds of things that you need to do. We just need to do it in a new and different way and following those distancing guidelines and those kinds of things. The stay-at-home order is important so that we can slow the spread of the virus. I do also want to talk a little bit about some things that we're getting questions about, and I just want to kind of go over those. So in terms of testing, there is a use of virtual app, whether you use IU Health's app or whether you use the CDC. And those apps are assessment tools, and we encourage people to use them. But a test means that you have physically had a specimen taken by a provider that's sent off to a lab for testing. So going through the app and being screened isn't the same as being tested. The criteria for testing is starting to loosen up a little bit, but it is still focused on those with symptoms and who are high risk of illness or spreading the infection. So that includes our healthcare workers. It also includes our first responders. So though there is some change that's coming, and I think as more testing does become available, we can see those loosen up more. But not only is testing somewhat limited, but also the supplies to take the tests. So that all of those things combined have made testing a little more difficult. In terms of directions that people get, so keep in mind, and the easy way to remember what isolation is that if you're in isolation, you're ill. So if you are sick with a confirmed test or you have a pending test and you have symptoms, then you would isolate until you're released per whatever those guidelines are at the time. Quarantine would be for those people who may have been exposed, but they're not showing symptoms that are consistent with COVID-19. And the CDC right now is if you may have been exposed to somebody to a possible case, then you simply monitor for symptoms. You don't necessarily have to quarantine. But again, I'll go back and say the governor's order is essentially that stay-at-home order is a please self-quarantine. In terms of businesses, the governor did extend his order for retail food establishments, and there are clear directions for local health departments and how to handle any non-compliance with those. We are following up with businesses who may be that we may be getting complaints on in terms of why are they open or people are gathering too much in those. We're not getting a lot of those complaints, but we are getting some. We will be following up with those businesses just to make sure that they have the proper guidance that they need and that they are instituting all the steps that they can to protect their staff and to protect their patrons. And again, as far as patrons, we as patrons also need to keep in mind that we need to limit our travel, that when we do go to the grocery or we need to make some essential run for something, that we go by ourselves. We don't take 4 or 5 people with us, that we go in, we get what we need, and we go back home. And as Commissioner Thomas said, I think most people are abiding by those. I want to commend our community on that. But we know that it's always helpful to just have those reminders of we still need to be doing those things. And if people are concerned or unhappy with a business, then please make sure that that management knows so that they can address that, because sometimes they may not realize just what may be going on a floor of a large space. So we would encourage people to do that. Thank you.
Thank you. Let's go to Allison Moore, Monroe County Emergency Management Director.
Thank you, Chuck. We continue to gather requests for and meet needs for our public safety, our first responders, and our hospitals, and of course our county partners through our virtual emergency operations center. We are currently have gotten several questions as to if we will be on a travel advisory. We are not implementing a travel advisory at this time. As we've watched our county, we feel that our citizens are being very smart, and we continue to encourage our residents to stay home unless you must be out for essential reasons. We are currently collecting homemade masks for various county use, mostly social services, and we have 4 sites where those can be collected. Those are on our county website, and that website is co.monroe.in.us. Those 4 sites are Northern Monroe Fire Territory, Station 5, Monroe Fire Protection District, Station 21, Monroe County Health Clinic, which is located on Miller Drive, and the Bloomington Fire Department Logistics Warehouse. And again, you can find those addresses on our county website. Non-related to COVID, but something I do want to announce is it's the first Friday of the month. So we are testing our sirens, our tornado sirens. And we just want to make that announcement just because there's so many concerns with COVID. So just so you know, it is our normal test. We had a successful noon test with all 47 tornado sirens being activated, and we will have our evening test again at 7 p.m. tonight. I just also want to mention that we have such a great deal of collaboration amongst our fire departments, our law enforcement, dispatch, EMS, hospital, and our health department. And we have a great collaboration currently amongst the State Emergency Operations Center and our County Emergency Operations Center. Lots of moving parts happening within our department. And I'm happy to report that there's great collaboration amongst and great effort amongst all those partners. That's all I have.
Okay, let's go to Brian Shockney next for IU Health.
Thank you. Again, I would reiterate, it's been said several times, but I'll reiterate that the collaboration has been fantastic, and the collaboration is for the best of our citizens. And that's why we're doing it. That's why we're in the positions we're in, and we appreciate all that's going on in the partnership. I want to talk about 3 things here quickly. First of all, testing, second, well-being, and then some surge planning that we're going through at the hospital, which you may have heard about. First of all, we also want to recognize all the the restaurants and community groups and the outpouring of cards and letters that we're getting from the community to our patients and our healthcare workers. There's not a day that goes by, a night that goes by that somebody has not delivered food to our workers, has not been in the parking lot, has not made phone calls, has not, like little kids writing letters to our nurses at the bedside. It's been overwhelming, and it's been very inspiring and uplifting for some very tired healthcare workers. And so we certainly appreciate that. It lifts our spirits and lifts our energy as well. We're also, trying to make sure we're taking care of our own as well. And so we're doing some good things for our own team members to be sure they get rest, and have found some places where they can go here in the community, partnerships with some local hotels and others, where we can send our employees and provide them a good night's sleep, or at least 4 or 5 hours sleep in between work that they're getting done. So we appreciate that as well. So first of all, let's talk about testing. Beginning today, Indiana University Health has expanded its COVID testing, not just to IU Health workers, healthcare workers, and the patients, but we now have, starting today, expanded that to our first responders, so fire, police in our community, and any healthcare worker in our region who meets the requirements for testing. So we still ask that they use the IU Health Hub. They'll call that IU Health Hub. They'll be screened. If they meet criteria, they'll get a barcode on their phone or sent to them by email, and they will go to the virtual hub and be directed to that virtual hub to be screened. So that is expanding. As I talked a couple times ago in last news conference, there are 3 phases of testing, and Penny hit on this as well. Phase 1 was just our patients and our healthcare workers for IU Health. This is full implementation of phase 2, which is all healthcare workers and first responders in our communities. And so we've been able to get enough testing media to be able to expand to that level. We have been doing some of that testing already with our partners, but now we're expanding it fully and making that a full announcement for everyone who is a healthcare worker or a first responder to participate. The well-being, the patient, staff, and contractor community, we want to be sure they're kept safe. There's been some questions around our construction project, and that continues to happen. Every contractor, we have about 450 workers out there on a daily basis, and every one of them is screened before they go to work. We are keeping our social distancing there and spacing out our work so that they do not congregate. Their meal times and everything else are spaced accordingly so that they are safe, and we do send them home if they hit in the screening criteria related to the COVID virus. One of the things that we are doing currently that we've had some questions about is our surge planning. So we, as Penny was saying, we believe we are about a week behind where Indianapolis is. And so we have been blessed to have that extra week or so to follow their lead and to be able to practice and surge. Just in the past 48 hours, we have had no less than 4 surge drills, and actually just finished one as I was getting on this call to be sure we're not missing any gaps. And what does that mean? That means that Bedford, Paoli, Morgan hospitals, all of our Southern Indiana physician clinics, and Bloomington Hospital, we keep testing. What happens when we get 50 patients in our emergency department? What happens if a nursing home has 12 patients that get sick and they need to send them to Bedford? How do we send help to Bedford and Paoli and move equipment around and move people around? And we test and test that over and over. And very happy to say our team is well prepared, and the ability to shrink down and not do the non-urgent, emergent cases and visits in our clinics has allowed our clinicians to be ready to expand their services. So we've been able to train and retrain some nurses, technicians, and physicians who haven't done some of this for a while. And so we've been able to retrain them and get them acclimated to the hospital environment again, and to other environments where they can be top-notch in their skills as we need to surge up for the number of patients that we take care of. We are very grateful to state officials who have combined efforts along with the Indiana Hospital Association to make sure that we've got plenty of personal protective equipment in our state, ventilators, ICU rooms, all of those things that are based on the models that the state is using for planning for these 8 to 12 weeks of this virus surge up and the slide back down. So the capacity for patients, we will continue to fluctuate. I can say, on March 13th, when we really started seeing COVID patients coming to our hospital, we have seen that same increase in the curve that others have seen it from around the nation, and continue to see that increase every day. And so we still continue to be on incident command 24/7, where we have all of our branch commanders on site, and we have the ability at any time to call everyone together and talk through any concerns or questions that we have. So we feel very well prepared at this point, and feel like and know that we've got everything we need for the surge at this point.
All right, thanks, Brian. Let's turn to IU Associate Vice President for Public Safety and Institutional Assurance, Ben Hunter. Ben.
Thanks, Chuck. Like the others, I appreciate all the cooperation, working together. For IU, we have our executive policy group continues to meet, and that's led by President McRobbie. We've continued our incident management teams that have been in place. We are now in day 67 of our incident management teams, and many of the folks on here, our external partners, have been on those calls with us from day one as we started monitoring the impact of our students overseas in China, Italy, and Spain. And so we were able to kind of see what was coming our way and get Indiana University prepared for it, and have made key decisions here throughout the IU system to react. One of the things that Mayor Hamilton mentioned, I will also mention, our police departments have teamed up and responding to off-campus parties or runs that may be called in reference to lack of social distancing in terms of the governor's order. We'll continue to do that. We always work well together. We're not only doing that here in Bloomington, but we have key partnerships in working with the Gary Police Department, and obviously the Indianapolis Metropolitan Police Department, and other smaller jurisdictions where the IU Police Department is located on all 7 campuses. We'll continue those partnerships. We've also have a great partnership with Monroe County, working with them, our environmental health and safety, and our IU Health Center, and reporting cases and suspected cases, and working on testing and contact tracing when needed. So we continue to do that, and we'll work together to make sure that if we have an individual that is, a clinical diagnosis or a confirmed test, that we'll make sure that we participate in any contact tracing, and also for us, making sure that we get the area, or whether that's a dorm room or some type of facility within IU, the system, that we're making sure that we get that cleaned by the appropriate staff and get that facility turned around. With that, I know it's widely expected that the governor will extend the stay-at-home order, and we may know that here late today or sometime soon, but our stay away from campus order is independent of the governor's order. So we've asked our faculty, staff, and students, except for essential employees, to stay away from our campuses, and all 7 campuses, and independent of the governor's order. That is until further notice from our executive policy group and President McRobbie. So we'll continue to message that. We send out several public safety advisories all the time to remind faculty, staff, and students what's going on in our planning and efforts around our COVID-19 response. And the last thing I'll mention, a large effort amongst the Indiana community, is the need and procurement of PPE, personal protective equipment. Just like any entity, we've been trying to procure that. We've donated 20,000 N95s to the IU Health supply chain. So that was done last week. We also donated 10,000 N95s to the state's strategic stockpile as well. And we've done additional donations of supplies to Monroe County. We've also, the city of Gary, worked with the Indiana State Police, smaller donations to make sure that folks have that equipment. I know there's an effort amongst the state to get our procurement folks together to try to do that and coordinate those purchases. And we most certainly will try to participate in that. But it is increasingly hard to get those stockpiles. And we're making sure our IU Health Center, our campus health centers, and our first responders within the IU system are adequately supplied as well. So as that continues to play out, we'll continue to appreciate everyone's partnership and effort in that front.
All right, thank you, Ben. So we'll open it up for questions. And again, media, if you have questions here, you can pose them here online or through the chat. We are monitoring those questions and also monitoring on Facebook as well. And so the first media question from Emily Ernsberger from the Herald Times. For Mayor Hamilton, in light of the 2 diagnoses of city employees this week, what specific safety plans for labor employees have been placed? Staggering shifts, skeleton crews, and what happens when entire crews cannot work? And do they have any type of PPE?
Thanks. Yes, we've had very, very significant changes really over the last several weeks. I have a document of multiple pages outlining what each department is doing to protect employees, perform their jobs differently. We've terminated some jobs, but just as a couple examples, our utilities department has changed the way all the utilities workers in transmission and distribution are working. They're never assembling. They used to assemble in large groups. They now never more than 5 or 6 in a very large staging area and warehouse. Police department has eliminated roll calls. We don't have our police officers in a room together. Generally, they're also completely segregated from the non-sworn officers. We have, as you know, the parks are changing their activities regularly to diminish interactions and assure physical distancing. That's one of the main functions of the continuity of city government group, which includes a number of department heads as well as some specialists, and they continue to review all of those procedures. I would note also, yes, personal protective equipment has been in place, particularly for police and fire, as they have, by necessity, interactions with the public. You probably know as well that our dispatch protocol for a couple plus weeks now has included anytime a 911 call comes in where appropriate, there are additional questions asked of the caller to try to determine whether there's a COVID-19 risk for the responders to that, whether it's EMS, fire, or police. And we'll continue to monitor that. I think it's fair to say, as you've heard, we're headed into more cases rather than fewer. These protocols will be continually reviewed, but we're going to see more cases in our community as we go in the weeks ahead, and we need to be ready for that. Thanks.
Question from Dave Ask, Square Beacon. A question for Brian Shockney. Cook Medical indicated last week they were talking to IU Health about using their sterilization facilities to sterilize masks so that good masks can be reused. Has that proved to be workable? And he says there's anecdotal reports of not enough masks at Bloomington Hospital. Can any health worker at the hospital get a mask if they need one?
Yes, let me address the first question regarding Cook. That's been a great partnership. Pete Youngman reached out to us early on in this event and said, hey, how do we ensure that we work together in this crisis? And they thought they had a way to be able to basically decontaminate masks and make them actually better than when they come to you out of the box from the manufacturer, more sterile actually. That process is working very well. They are doing the final testing on that, and we hope to have an announcement here pretty soon within the next 24 to 48 hours regarding the re-sterilization of those masks. We are very lucky and very blessed in this community to have Cook Medical who can put their engineers to work and make this happen. So that is going forward. Everything that we've trialed, everything to date looks like it's going to work. We just have to be sure that the FDA blesses it and we can demonstrate that we can do this on a ongoing basis. As we see it now with the FDA, once the FDA approval is done, their capacity would be not just for this region, but also for all of IU Health to help support the re-sterilization and masks, which would be at a higher sterilization rate than what we're getting from a factory out of the box. So the second question regarding PPE. So we do have plenty of PPE for our employees, even in the surge. There was some confusion in our communication regarding why we wanted people to conserve. So CDC guidelines are what we follow. And so we want to be sure that we're good stewards. It's one of our good stewards of resources. And so we issue those masks, whether they're surgical masks or they're N95 masks, to an individual. It's their individual mask. And then they wear that through their shift. If that mask becomes soiled, then they take it off. But what we don't want happening is people continually, I go to the cafeteria, I go somewhere else, and I'm continually taking off my mask and throwing it away. Those masks, all masks and all PPE, except for certain PPE, can be used for the entire shift if it's not soiled. So we want to be sure that we're good stewards of the resources, because we have other people, as we've gotten N95s from the school corporation, we've got PPE from Indiana University. It's been great, the supply that we've been given, and that supply has made us to the point where we don't have any concerns regarding PPE. However, we do not know what surge we're going to hit, just as New York did not know and others did not know. We feel pretty good about it, but we can't be too careful. And so we would be foolish if we loosened our standards beyond CDC standards of use of protective equipment. And so that's why we have said we're going to use according to CDC guidelines. And if your mask becomes soiled or if your clothes become soiled, we will follow the guidelines that way. But we will not. We cannot keep throwing away masks and PPE when others are going short. And we may at some point need to share with others besides IU Health facilities. So that's where the confusion, we believe, started. But we do have plenty of PPE, and IU Health was able to just recently get new shipments of PPE for our entire organization. So we're feeling very, very good about it, but again, being very conservative and good stewards of the resource.
Another question from Dave here. On the topic of testing, only 278 COVID-19 tests have been done in Monroe County, according to the ISDH. Have there been any collaborative efforts between biochemistry laboratory at Indiana University and IU Health to explore the use of those lab facilities for testing, or is there some other limiting factor that those labs can't help with?
So I'll defer to my IU colleague. I don't know of any collaboration there or their capacity at this point.
I don't know either. So Chuck and I will have to check in and kind of dig into that question, and we can get back to you.
Yep. And to that point too, we clearly are not going to get to everybody's question here. We will try to follow up with answers on Facebook afterwards as well. Ethan Burks from WTIU WFIU asks this: several medical experts and organizations have said the best way to treat patients is to test them for the virus, isolate them, and then identify everyone they've come into contact with. Is Bloomington, Monroe County taking the same approach? a Penny question or a Mayor question?
I can answer that to some degree. I think in an ideal situation, I would definitely agree with that. Ideally, regardless of what communicable disease we're talking about, to be able to test people and deal with, those test results and those close contacts and do that contact tracing is the ideal. When testing and testing medium, the supplies to take the test is in short supply, then you just can't do that. And so that's what's happening here. We are doing the contact tracing. So when somebody is a confirmed case, then we do talk to them and identify their direct contacts, and then they are given advice based on those contacts as to what to do and what to follow. Unfortunately, with a pandemic and where we are right now, everything is not ideal or in those normal circumstances. Hopefully we'll get there.
I just would add thanks, Penny, and thank you for all you're doing with the help of that tracing and that work. And it is an example of the lack of testing that is a detriment. We would like to be doing more testing. We just can't, as it said, but hopefully we'll get there soon.
Okay, and another question that Ethan has for Brian. What's the status on the drive-through testing site at the Bloomington Hospital? And he also asks, what's the status on construction of the new Bloomington Hospital site? Could it be finished sooner than expected and help out during the pandemic? And before you answer, let me throw in another question I saw that came in on Facebook earlier, sort of related, asking about how the construction on the hospital is continuing and why that is deemed as an essential service right now.
So as far as the construction, I'll answer that first. We continue to do construction. We are on schedule and on time. Why is that continuing? Because we do have, sorry for the sirens. And so we do have a deadline to meet there as well. Part of, there's two things going on here. One, as we fight this pandemic, we talk to our employees about, we're working in two columns here, two lanes, and there has to be some normalcy to what we're doing. And while we have, put 90% of our efforts toward the COVID-19 virus and this pandemic, we do have meetings. We still have our Friday morning meetings regarding the construction, and that brings some normalcy to this time in our lives. And the construction site, we continue to keep that moving forward because we have all the supplies. We also want to keep people working. And with the governor saying that is construction is one of those areas that can move forward, we want to make sure people continue to be employed and provide for their families. And so that's part of this. And we're being very smart about it as we're screening every person who's coming to that site, as I said before. So, we really want to be sure that we keep that moving forward for our community as well. And I will say that our facilities, the reason we're building that is our facilities are tired here in Bloomington, and every day is a challenge for these buildings that we're in. And so slowing that down would create more challenges for us. Now, the first question around testing, we have the community testing site as far as healthcare workers is not located on the hospital site anymore. The yellow tent outside the ED is for our emergency room patients or patients who are referred to the hospital for testing by a doctor's order, and we test them there and then take them through the emergency room, and we have negative pressure and all the precautions that we need there. So that is no longer the testing site where the virtual hub, if you call into the virtual hub or go online to the virtual hub, that you'll be sent. Actually, there's the other testing site is a drive-through testing site, and that's where people actually stay in their car and we come to you and we test you while you're sitting in your car, and then you drive through and out, and then within 24 hours we provide you your results.
Okay, so very quickly, we're running out of time, but I'm gonna try to squeeze one more in here. This is for Mayor Hamilton and I would say Ben. How will IU and the Bloomington Police handle large group meetings that many have been seeing on porches and front yards around town? What will the enforcement look like?
I'll just say quickly, we'll stop large group meetings. We appreciate reports of those when people see them. As Ben Hunter said, IU and IU Police and Bloomington Police have kind of divvied up the community in terms of geographic areas to respond to. Please let us know if you see such a thing. Not only will the police respond, but they'll also engage in a very active way, and we appreciate that. The IU Dean of Students reaching out to students for that. And if it's not all students, of course, we would deal with them as residents, but we want to stop those gatherings. And I think generally the intervention and consultation makes that happen. And I'll hand that to Ben Hunter.
Yeah, I would echo that. IU Police will respond. We've been in daily contact with BPD and Chief Dekoff. One of the avenues that we most certainly have, as the mayor mentioned as well, is student conduct. And so if they are students that are living in off-campus housing, and they are, because some of them are not breaking their lease and they've signed these leases that they're going to continue to stay in the IU community. If they are holding these gatherings and they violate the governor's order, we will respond. We appreciate those calls, the collaboration, and we will hold our students accountable, and the Dean of Students is doing just that.
Okay. We are really pretty much out of time. Again, we will try to get to a lot of the questions that have been submitted and we haven't been able to answer here live in responses on Facebook afterwards. But we appreciate your time. And next week we will be back again, same time, and we will send out an advisory again, but it is likely to be the same Zoom address as well. So thank you all for your time, and thanks everybody for being here.
Thank you, Chuck, for coordinating. Appreciate it.
Thanks.